Hello everybody, my name is Derek Clewley. Today I'm presenting on the topic of career track planning. This topic is a beast of a topic. In fact, I had earlier discussions with some folks about how can we reduce this presentation to less than 30 minutes, for we know the research suggests that anything between 20 and 30 minutes is about as long as we can go and keeping the attention of all attendees. So I will do my best. But know that this topic is a very large topic and one that is going to get a lot more, or needs a lot more discussion than what we're going to spend with it today, specifically in the presentation. So my goals and my hope today is not to necessarily tell you how to plan your career or tell you exactly what you should be doing to plan your career. More than anything, I hope that it provides inspiration to planning your career out as an occupational therapist or as a physical therapist here at Benchmark Rehab Partners. If success is defined as happiness, career success as happiness, then I guess that allows me to present on this topic as an expert. I am certainly one of the happiest individuals in my profession, in our professions, that I think there ever could be. A lot of that has happened by timing, and good timing for sure, and a lot of that has happened by due diligence. And my hope is today to give you some insight into how you can go about planning your career so that way you maintain and facilitate your happiness to be happy within physical therapy. My role here at Benchmark Rehab Partners is I am the director of our residency programs. And what I hope today is to have you look into, obviously, residency training, but that is not for everyone. And know that not everyone has that opportunity to do so. So my goal is to really broaden that out beyond even residency training. I've actually been a part of Benchmark Rehab Partners for going on 9 years now. And I can absolutely say that we are all part of an organization that is doing the absolute best to help us define ourselves as professionals and define our career and jumpstart our career essentially. So these are my objectives essentially, but I think my main objective, as I already stated, is to truly inspire you. We will talk about career tracks. We will talk about some specialty tracks. We'll describe some differences between some of the educational offerings that are out there, specifically in that post-professional manner. And we'll talk also about developing your curriculum vitae and identifying continuing education opportunities, even post-residency training or post-early clinical training. We really have a hard time defining a career path without using the metaphor of a road or a trail. And the way that we can look at our career path in looking ahead or even in hindsight is our career path defined clearly? Do we have that nice clear path where there's no obstacles in the way? It is a nice, easy, fast ride getting to where we want to go to. And for some of us, that might be the case. However, I would expect it to look a little bit more along the lines of this. And of course, this is Atlanta traffic, and traffic here is actually moving, which represents probably a little bit more of a realistic career path, if you will, in that there are significant obstacles, significant delays, and significant congestion along our path to what we would consider a successful career. The one thing that I do want to make sure of, though, is that we have a path that isn't just a joyride. And if we look at our professions and link it to, and continue to link it to driving a car on a road and driving down a path, we certainly just bought ourselves some really nice cars. In fact, our cars are top 10 cars, right? And all kinds of different ranking systems. The car that we have now purchased, meaning our PT degree or our OT degrees, is a really good car. In fact, it's one that we could probably take just for a nice drive. We could take this thing out on a clear path and just go for a drive, kind of like that shows the video there of just a really pretty drive. Now, that certainly is enticing and it is doable, but it isn't the most advantageous way of developing ourselves as professionals, because it will happen whether we like it or not, and taking control and allowing ourselves to take those risks and getting through some of the congestion and getting through some of the intended purpose of our drive will only allow us to be better professionals. Well, I alluded to this just a second ago in regards to top 10 professions. And in fact, I think there's a more recent one that just came out, but this is probably a couple of years old. I think it actually shows 2012 on the CNN Money slide at least, but it hasn't changed. And we can look at Forbes, we can look at USA Today, any sort of poll servicing out there will show that we are in top 10 professions, physical therapy and occupational therapy. And these can be flipped. I've seen them as high as top 5 professions. We are a happy profession. So let's take advantage of it in a way that will allow us to become even higher level professionals and really take advantage of the awesome careers that we have chosen to be a part of. Well, some difficult decisions have already been made, right? In fact, actually going into PT and OT school, you probably thought, well, you know what? When I get done with school, I'll be set and ready to go. I'll be fat and happy, and I can just enjoy the fruits of my labor of school. Obviously, when you get into PT and OT school, you recognize that is absolutely not the case. And in fact, thankfully, there are a lot of opportunities for us to develop ourselves as professionals beyond our entry-level education, meaning our post-professional education. So yeah, exactly. Grandmom's proud of you. Grandmom's proud of you for getting there, reaching the pinnacle, what is perceived to be maybe the mountaintop of a career plan there. We have a lot of work that we get to do to develop ourselves continually as professionals. The other piece is that you are an employee of Benchmark Rehab Partners. Well, that's a great thing. We are, as I said earlier, a part of an organization that really values and prides itself on providing opportunities, immense amount of opportunities. And I've had the opportunity to witness so many fine folks in our organization take advantage of these opportunities, and these opportunities are only going to continue to expand. So we have to have a plan. And part of our little breakout that we're going to do today is going to be to develop a plan. But we want to talk about sort of those short-term plans, moderate-term plans, and then those longer-term plans. Absolutely, you need to write these down. You need to write down your 2-year plan, your 5-year plan, and your 10-year plan. And the reason why is because it'll give you some focus. Now, those 2-year objectives, you'll probably meet those if you write those down and are well-intentioned. 5-year, you might not get to because you don't even really know where you're really wanting to go. And 10-year, it's likely that you won't be. I had no idea that I was going to be pursuing a PhD and doing an interest in research and teaching back when I first started as a PT, entry-level PT. But this is where I am at now. But I've gotten here because I've had some direction. And it hasn't necessarily always been this path, but I've had at least an intentional focus. So write these career goals down. Also establish your plan for what you want to do with Benchmark, what you want to do in the profession itself of OT and PT, and what you want to do to establish your involvement with our associations or our profession. So beyond even just those clinical walls. And that doesn't necessarily mean part of the APTA and those sorts of, and AOTA and those sorts of things, but maybe even involvement in your community, involvement in service, and these other things. We pride ourselves at Benchmark for also having these opportunities to provide for you as well. So start putting those in components of your career plan. Actually, let me back up here. There is one important key piece missing from any plan, and that is we have to have passion and motivation for what we're doing. If we have passion and motivation, these 2-year and 5-year and 10-year goals don't seem like tasks. They just seem like things that keep us on the straight and narrow, essentially, if you will. So we have to maintain that inspiration and motivation. So do what inspires you. Do what motivates you. And if you do those things, then you're going to get to where you want to go, and you're going to get there in a very amazing way. So always remember that we're going to put a little objective pieces to a lot of the things, but around the whole entire objective component is the bubble of passion and motivation. And when you have those things, then everything else is just going to guide you and direct you in the appropriate manner. It's hard to talk about career planning in physical therapy without almost bifurcating it in a sense, in a clinical path and a leadership path, business leadership path, if you will. And by no means do I intend to bifurcate these and sort of think of these as two different paths that you have to go on. And quite frankly, some of my best colleagues and friends and actually my mentors do both, and they do both extremely well. So don't feel like you have to subscribe to one direction or another direction at this point in time. And in fact, you can go down both tracks at the same time, which is a little bit interesting. It makes it really challenging to talk about both at the same time. But if you have an interest in both and you want to do both, reach out to folks in our organization. We'll get you into contact with those that do both and do both very well and allow you to get some guidance from them. But to go back on this, when we look at the clinical path, in our structure, in our organization, we have the new grad path or new grad starting point, which is where all of you are at. Many of you may be graduating today. If you are graduating today, congratulations. Then we have the mentorship graduate, so that's 1 year plus. And then senior therapist, which is that tier 1 track, and then going into master clinician. There's research and faculty tracks, especially with some of the things that we're doing in our organization. Obviously, leadership track, we have a very defined leadership track, including clinic director and mentoring into clinic director, area director and regional director, as well as other opportunities that the leadership development program has actually provided for. And what else is a part of a career track plan? Well, your membership involvement, as I mentioned earlier, and then even starting to think about, well, what do you want to do maybe other educational wise? Do you have an interest in pursuing PhDs or DSC or OTD or DPT or MBA or whatever it might be, or even advancing your OTA or PTA degree into a PT/OT degree? So why should we have a plan? Well, there are many opportunities. And surprised you don't know everything. And in fact, as you graduate, you are very much a generalist. And it's only through post-professional education that you become a specialist in your field of practice. And when you have a plan, you can focus your effort on those things that are important to get to your career goals, those 2, 5-year, and 10-year goals. What's interesting, though, about career planning, if we look at it at this point, it looks a lot like you walk into Ryan's Buffet or Golden Corral or whatever your favorite buffet might be. I actually don't get a chance to eat at those places too much. My wife is not a big fan. I personally kind of like them, but they're dangerous, aren't they? I mean, you walk in and you got the smell of all the foods, every food that you could ever imagine. And if you're hungry for pasta, you can have some pasta, but at the same time, you can also have a little bit of Mexican food. You could have a little bit of steak, and you could even then jump into some of the dessert bars. In the whole process, you feel kind of bad about yourself, so you end up going into having a salad to validate and make yourself feel a little bit healthier, etc. But at the end of the day, you just don't really feel good about yourself and the food that you ate and such. Continuing education is a lot like this for both PT and OT. And you start looking at all the things that come in, the mailers, the educational opportunities, the sessions of training, and the certification programs, and all of this stuff that is out there. It's a great opportunity, but it just becomes hair-pulling and confusion into what you want to actually focus your effort into. And so this slide here depicts just so many of or actually just a small sampling of all of the potential things that we can do in physical therapy as well as occupational therapy. So when we start to look at this, Benchmark, we are very much a orthopedic practice now. All of our friends and colleagues in the neuro side would say, well, you can't have muscles without nerves and those kind of things, which we validate that. But in the definition of physical therapy and occupational therapy, we are falling in under that orthopedic side of things. And within orthopedics, we have board certifications, including your OCS, very much, it's an APTA board certification, CHT, so certified hand therapist for both OTs and PTs, and sports certified specialist, again, another board certification through an APTA. How do we get there? Well, we can get there by doing residency training. We can also get there by using fellowship training. When we talk about manual therapy, we can certainly get there through fellowship training, but we can also do certification. And we also have technique and continuing education certifications, as well as for our PTAs, we have advanced proficiency that we can work through. And so I'm going to talk about a lot of these as we go throughout. I do want to make sure that I'm inclusive of all professions within all clinical professionals in our organization. So OT, PT, PTA, and OTA. That being said, there's a lot of things that are very specific to each of these professions that will be a little bit delineated there. That said, I do want to make sure that I make this clear as we're talking through this. Know that a lot of these things that we talk through will actually fit and overlap into some of the areas, and I'll make sure that I bring that up. But when we talk about physical therapists, certainly the highest level of certification is board certification, and within the physical therapy profession, we have 8 specialties that have been essentially developed as board specialties. And there's a brief history here. You can read this slide. I'm not going to go into depth on the history of this, but know that orthopedics is one of them and sports is another. And there are other developing and actually newly added specialties, including women's health, which is the most recent. There are a couple options and a couple ways at getting your OCS. You can certainly do the experience route, or you can do more of a residency type training, and we'll get into that in a few moments here. The process for applying for your OCS, you need to apply in the year before by the month of July. And then if you're accepted, then you have to pay your exam fee by November, and then you take the exam in February, March, and then you don't get your results until June. We actually have folks that are taking the exam here in this month of March that are actually going to be waiting about 3 months before they get their results. So that long wait period is sometimes intense. What does the OCS exam cover? Well, it covers everything in orthopedics. And when I say everything, I mean everything. There is what's called a description of specialty practice. And the description of specialty practice has very specific percentages within that covers everything from all the spine regions, all the extremity regions, but then it also includes things beyond the description of specialty practice, including statistics and research, and it is inclusive of all age ranges, so pediatrics and geriatrics, as well as our midlife. And then it's a case format exam with a lot of series of questions that come after that. Similar to the NPTE, only more extensive and longer. So the other board certification that is common within Benchmark is the certified hand therapist. And a certified hand therapist, and I'll read this here really quick, is an occupational therapist or a physical therapist who has a minimum of 5 years of clinical experience, including 4,000 hours or more in direct practice in hand therapy. In addition, the certified hand therapist has successfully passed a comprehensive test of advanced clinical skills and theory in upper quarter rehabilitation. Because of changes in the profession, every CHT is required to demonstrate continued professional development and competency by recertifying every 5 years. So again, like the OCS, the CHT is not for the faint of heart. This is a very intensive process and intensive examination. However, we have some great mentoring and guidance through some of our programs that we offer here at Benchmark that can get you into that right directed path. And so if you have a strong interest in that, please reach out to the mentors that can facilitate that for you, or reach out to the Committee of Clinical Excellence to make sure that we can get you into that right direction. So here's the requirements. Again, 5 years. This is a little bit of a dated slide, so forgive my dating on this. But again, you do need to have an extensive amount of clinical practice, specifically in hand therapy. What I want to do is back up just a few moments here and talk about, well, how do we get to these specialties? And when we look at the ways of educational development and the paths of educational development, there are a number of ways to get there. Now, the old school PT way and to some extent as well, the OT direction was you graduate with your entry-level degree and then you go on and you do continuing education. And then that's how you develop yourself as a specialist. And a lot of it was your selection. A lot of it was you went to the smorgasbord, the buffet, to pick and choose what you wanted to do. Well, instead, what we're seeing now is the transition, especially in physical therapy, and we're starting to see it a little bit in OT, is the transition toward the more medical model of education. And the medical model suggests that when we graduate as generalists. There's no need in trying to specialize our professions within an entry-level program. That's pretty much well stated, especially in physical therapy. We had a big conference here about a few months ago that they pretty much decided we're always going to maintain generalist education. But we know that we are moving to specialty practice, and that's where residency training comes in at. And it matches right along with the medical model of education. When you graduate from school with your medical degree, you are a generalist and you have to go into residency training to practice and to become a specialist. Now, we're not mandating and requiring residency training at this point yet. It's mainly optional, but it is the absolute most efficient and most productive way of getting to specialty practice, preparing you in physical therapy for board certification orthopedics. And we are also in the infancy of development of a hand therapy sort of residency program. We have the mentorship program, but we're looking at a more intensive residency program. And all of that matches that medical model of developing you as specialist. Where do you do residency training? Obviously, if you're in orthopedic physical therapy, we have our own internal residency program that is accredited by the APTA. We are also in the development of a fellowship program. And we are also in development of many other sort of continuing education opportunities. But if you're looking at that medical model, that residency to fellowship level training matches along that line. So again, residency leading to specialization. Fellowship will actually lead to more of what we consider mastery. So why residency, why fellowship training if this is something that you are interested? Well, residency training is designed to enhance and create clinical hands-on skills as well as some of your clinical reasoning pieces. Strong evidence-based practice. Our program is developed centered around evidence-based practice. And in fact, if we look at the description of specialty practice, in the OCS exam, it is actually very well written toward the highest levels of evidence now. So our residency program absolutely prepares you for success in your OCS exam. Also, continuing education is your continuing education piece for at least the first 1 to 2 years. It is an intensive and focused direction. It keeps you on that path, right? It doesn't allow you to go over and get the brownie from the buffet line while you also have a bowl of spaghetti sitting on your plate. So it keeps you on the straight and narrow. You become a clinical specialist and you sit for your OCS. If we liken that to our hand therapy, the idea there is to get you the hours to develop you to be able to sit for hand therapy, CHT. Fellowship is another level, and that may seem like a long ways away, but if you put in your 5-year, 10-year plan, those things will happen very fast. If fellowship is a part of that plan potentially, it's going to lead to more of a mastery of skills, allow you to become a teacher essentially, and then also a distinguished practitioner and educator. Obviously, I just said this, where to go, right here at Benchmark Physical Therapy, Benchmark Rehab Partners. We are an accredited residency program by the APTA. We are also in the infancy of development of a hand therapy residency program. So there's also, I joke about, getting the brownie with the spaghetti and your taco and your salad and such. There is value, though. I don't want to devalue continuing education. In fact, continuing education is extremely valuable. And in fact, after you're done with residency training, that's what you need to be considering. Or even considering that now, pre-residency training, or if residency isn't in your ability or in your cards, then it is certainly a valuable way to go. It is a tested method of where to go. But I would suggest and urge you to have the discussion with your mentors about where you might want to actually spend some of your continuing education dollars. One of the big differences between continuing education and residency training is the lack of mentorship in continuing education. Mentorship is mandated and must occur in residency and fellowship training. It is the piece that sort of integrates all of your educational pieces into one arm of education, as opposed to continuing education, which is something that you'll take on a weekend, you'll develop your skills, and then you are expected to then just be on your own for transitioning that into clinical practice. But there are a number of great continuing education pieces out there, and including some of the soft tissue intervention skill sets such as ASTIM or dry needling, movement assessments as well as many other continuing education. Again, consult with your mentor. Consult if you're an OT new grad. Consult with your OTs about where they are going to get their education from. If you're a PT, where are they going to get their education from? Knowing that you may be done with residency in a year and a half, you may want to start thinking about where you want to take your next level of education, your continuing education. Within manual therapy, so the subspecialty, obviously fellowship training is the highest level of training that you can go through for manual therapy, but there are a number of great options for continuing education and certification. You'll see a lot of these alphabet soups even within our own organization, such as MTC, CIMT, COMT. A lot of that has to do with the certification program that they went through. And so this is a lot of the therapists are trained in Great Lakes, EIM, Spinal Manipulation Institute, NIOMT, and the list goes on. So a lot of opportunities and a lot of options for manual therapy training. All right, I want to give some special attention to our physical therapist assistants. And one of the things that we can start doing is, if you're a PTA, is start looking ahead at being recognized in advanced proficiency. And this is an APTA directed thing, if you will, where we are sort of recognizing those physical therapist assistants who have done a significant amount of training and have become really sort of amazing clinicians in of themselves. And so the advanced proficiency for physical therapist assistant, what you'll need to do is you need to, one, talk with either your clinic director or a PT that you work with and let them know that this is your intention. And start that intention right away, because you'll need 5 years of experience and you'll also need a recommendation from a physical therapist. Categories, there are a number of categories. Obviously musculoskeletal would probably be where you would fall into. The requirements, again, you need to be an APTA member. You're required to have 5 years of experience and a minimum of 2,000 hours of training or of contact hours with the patients. 60 contact hours, so educational training. You should at least have as much of that as within a 5-year period. And then above average job performance, again, supervising PT or another PT that can provide a letter of recommendation. And then evidence of involvement in 3 activities that demonstrate applicants' leadership abilities. And again, the benefits, significant reinforcement of lifelong learning, increased confidence in your patient care, and assist with your career development and recognition. So please go to the APTA and look at that and research that as an opportunity. That is a tier 1 certification for us. So if you have an interest in being a senior therapist as APTA, this is the best route to go down. There are a lot of other specialties in physical therapy and occupational therapy for that matter. And I'm not going to go into too much depth on these, but if you have interest in sports, know that there are residency training opportunities out there, as well as certification training programs that can get you into the sports model. Vestibular training, we do a lot of our PTs get a lot of training through the Emory University. That is actually a tier 1 certification as well too. So if you do take that, neuro, women's health, lymphedema, and the list goes on and on. So real quick here too, I want to talk a little bit about beyond the clinical setting. Some 5, 6, 7, 8, 9 years ago when I started doing these presentations, we didn't have, a lot of our PTs were still graduating with their master's degree, and so there was a lot of discussion about transitional DPT. We're actually starting that conversation now more with our OT friends and having the discussion about moving into transitional OT degrees. And we actually have a few PTs that have gone on, a few OTs that have gone on to transition their OT entry-level degree to a doctorate level degree. If that's an interest with you, please reach out to us because we can get you down the right path for that. But if you want to go into a little bit more of a research side of things, then the DSC or the PhD is the route that you would need to really go into that route. However, that being said, we do have research programs within our own organization, including in our fellowship training. We do have an extensive amount of research training within that as well. And again, I mentioned this a lot earlier, but membership, be involved. That's all I can say is get involved with the APTA, AOTA, ASHT, AOMT, whatever it is, your state chapters, your regional chapters, whatever it might be, and get involved. Get involved as much and as often as you can. Your association may not represent exactly what you want, but if you are not a voice within that, then you're not ever going to be heard. And so get involved, be an active voice. At the very least, just become a member. But again, without our associations, we would not be practicing in such a great profession. We wouldn't have top 10 cars, okay? We would have Yugos and Renault or whatever it might be. Try not to offend anybody's car ownership out there. I think those are safe. Last, I want to talk a little bit about your curriculum vitae. And this is probably a little bit of a foreign topic for you. because we don't give it much talk and discussion in PT and OT school. But start developing that. Go to the BNet, pull up one of those. You can search Curriculum Vitae and you can find tons of examples out there. If you need an example, I'll send you mine as an example. But get out there and start listing everything that you're doing, because as you progress through your profession and your career, it's going to be amazing how much you've done, and it's going to be hard to remember all that you've done. It'll serve as your library of accomplishments, if you will. But it will also serve as a way for you to reflect and project forward where you want to go with your career beyond where it's at right now. A couple of quotes to wrap everything up with, and one is by Dale Carnegie, and I think it's a really important one, and it's that people rarely succeed unless they have fun in what they are doing. I mentioned this earlier. If you have passion and motivation, you probably have a lot of fun. Have fun in what we're doing. Be intentional with your fun as well. And then finally, can't have a good presentation without a quote by Vince Lombardi, so we're going to throw one in here, but it's a very good one for this presentation. The difference between a successful person and others is not a lack of strength, not a lack of knowledge, but rather a lack of will. You guys are all smart enough and motivated enough to do amazing things. Dig deep, get the will to do some amazing professional things within your career. And this is the time that you are likely even the most excited about your career, because there's so many opportunities for you to go with. I thank you guys very much for all of your time this morning. I look forward to seeing all your careers develop into some amazing things. If you have any questions, please let me know. I'll talk to you guys later. Have a great day.